What is public health?
Public health is promoting, protecting, and improving the health of the general population and their communities through the efforts and help of society, communities, governments, and individuals. Some examples of public health are access to vaccinations, enforcing laws, preventing disease spread, safe foods and water, safer workplaces, problem with gun violence, and more. What is the problem?
Fentanyl abuse has affected everyone, including children and families in local communities. According to the Behavioral Health Service of Santa Clara, in the past 5 years, there have been 639 overdose deaths. 460 involve fentanyl. In 2022 alone, there were 160 fentanyl deaths, almost 15 times more than in 2018. Fentanyl related overdose was the cause of death for people as young as 12 years old. And also, according to the County of Santa Clara News, fentanyl related overdose deaths for 2023 in Santa Clara County more than doubled at the end of May, with 41 deaths compared to 17 recorded deaths at the end of April 2023. These, stat- these statistics show a problem as the rise in fentanyl deaths has caused harm and created a dangerous situation for the communities in this county. According to the NBC Bay Area, a toddler has died in a fentanyl related death due to parent negligence. This is significant as even toddlers at the age of 18 months are unsafe from fentanyl deaths, which means that anyone at any age can die from fentanyl. What are the risk factors?
The cause of this health problem is the increased amount of fentanyl-laced pills and other fentanyl-related items. Drug dealers do this to increase their profit margins, as fentanyl is extremely addictive. Drugs are too easily available, and fentanyl is extremely potent. According to the Behavioral Health Services of Santa Clara, fentanyl is 50 times stronger than heroin and 50 to 100 times stronger than morphine. People who get hooked on these fentanyl-laced items will want more and eventually be addicted to them, possibly leading to an overdose. They mix fentanyl with cocaine, heroin, meth, and other drugs because fentanyl is low cost and gets them more customers. Fentanyl kills with a very low dosage, as low as 2 milligrams. According to the Drug Enforcement Administration, 42% of pills are laced with 2 milligrams of fentanyl, which can kill the user. What have we tried to do before?
There have been a multitude of interventions, policies, laws, programs, local organizations, etc., that have been created to address fentanyl use. Some have been somewhat successful, some very successful, and some not. Some of the legislations made are Senate Bill 1109, Senate Bill 10, also known as Melanie's Law, Senate Bill 250, Assembly Bill 701, Senate Bill 19, and Assembly Bill 1060. These are all related to fentanyl have been very successful. For fentanyl related crimes, the sentences can be very harsh, from fines, drug treatments, counseling, to jail time. These harsh sentences have been successful as well, diverting many from fentanyl. There are also programs like the SCCOOPP and the Harm Reduction Program, which has been very successful in making fentanyl safer. A local nonprofit organization, Alum Rock Counseling Center, also aims to make a difference with the youth consuming fentanyl and have also been successful. What is our program to combat fentanyl overdoses?
The program name will be Never Alone with Naloxone. The people that will run it is the police departments, hospitals, and firehouses in Santa Clara County. Everyone in Santa Clara County will benefit as everyone will be safer if someone overdoses as they will get the proper help needed. How much will this policy cost and who will pay for it? This policy will be free for everyone and we will use taxes that Santa Clara citizens pay. This allows for citizens to feel like they're getting the healthcare they are entitled to, which will help the community be a safer and healthier place.
Where will the resources and services be located?
Our naloxone program and services will be located at health centers, clinics, hospitals, pharmacies, first responders like police, fire departments, and EMTs, public gatherings, events, other medical related programs, social services, schools, universities, jails, workplaces, near public transportation, and generally everywhere.
How will we evaluate and ensure that those most in need get the resources and services they need? Our program can monitor data collection, such as distribution, usage, outcomes, demographics, successful overdose reversals, the amount, etc. The local community and neighborhood can have surveys often to see how the program is working. The program can also host events often get data and info reliably from the target audience. We can have evaluations on our policies, procedures, and training to ensure that it is up to date. We will map geographically to see the highest overdose rates in certain areas. We will ensure that our naloxone will be equally distributed to others regardless of background. We can ensure that our naloxone will be available everywhere and that everyone is aware of our program through advertising. We will plan out our nonprofit program to ensure that we are sustainable through sponsors, donors, taxes, and more.
What can you do?
The community and individual support from Santa Clara County is crucial for the success of a public health program like Never Alone with Naloxone. Without it, we would have funding, awareness, employees, events, etc. To support a program, they can do many things. They can raise awareness about Naloxone program with neighbors, friends, and family through social media platforms, face to face, and more. They can attend training sessions and encourage others to join these sessions to help recognize the signs of an overdose from an opioid and how to give naloxone to someone. They can advocate for our program, whether it's directly to policymakers or other individuals. People can also volunteer and host events. People can support those who have overdosed and are recovering or in rehab. People can participate in our surveys to give us proper data. We appreciate all the help and support from everyone in these times.